Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an October 1st, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 3,503, which is 314 new COVID-19 cases in the last 7 days. I'm sad to report 2 additional deaths this week, so the total number of COVID-19 deaths in Dubuque is 43. 23 Dubuque County individuals are currently hospitalized, and 61% of Dubuque County positive cases have recovered to date. The 14-day average positivity rate is 15.6%, down slightly from Monday. And the age group with the highest number of positive cases is the 19 to 24-year-old age group with 21%. Those aged 15 through 29 make up 39% of all Dubuque County cases. The state added 3,014 cases since Monday, September 28th. As of October 1st, 2020 at 2 p.m., Iowa has a total of 90,004 positive cases. 11% of Iowans tested have been positive overall, and the 14-day average positivity rate for the state is just under 9%. Deaths reported in the state total 1,360 Iowans. Currently, 407 cases are hospitalized throughout the state. This has increased by 54 since this past Monday, September 28th. And finally, about 77% of Iowans have recovered. Tuesday, Governor Reynolds issued new recommendations for when to quarantine. For non-healthcare, non-residential settings, quarantine is no longer required if a potential exposure occurs while both the infectious or positive COVID-19 individual and the close contacts are wearing face coverings consistently and correctly. You heard me. If both parties are wearing a face covering consistently and correctly, even if they're within 6 feet of each other, the exposed person does not have to quarantine for 14 days. They still must monitor for symptoms to develop. The key words here are consistently and correctly, meaning the mask cannot be removed and must entirely cover the mouth and nose for the entire time the 2 people are within 6 feet of each other. Also, only face coverings are acceptable in this quarantine guidance. Face shields and gaiters are not considered an adequate form of protection for not having to quarantine. So if only one party is wearing a mask, the 14-day quarantine is required for the exposed person. This guidance does not apply to healthcare settings or residential or home settings because it's not practical for everyone in a household to wear masks all the time. Keep in mind, this is only guidance, and a particular work site, business, institution, school, fitness center, or other venue may be more cautious and still require quarantine regardless of the mask wearing for their employees, their students, etc. One data point I usually don't spend a lot of time on is the number of hospitalizations due to COVID-19. I always report on how many Dubuque County residents are currently hospitalized with COVID-19, but I also want everyone to know that we are in regular communication with our hospitals on their current capacity in terms of available beds, staffing, the personal protective equipment or PPE, visitation guidelines, and other COVID-19 related issues. This week, the CDC reports that 3 national forecasts predict a likely increase in the number of new hospitalizations per day over the next 4 weeks. 2 forecasts predict a likely decline, and 4 forecasts are uncertain about the trend or predict stable numbers. These forecasts are based on predicting models developed by places like Columbia University, Johns Hopkins University, the Georgia Institute of Technology, Harvard School of Public Health, and other modeling groups and institutions. And yes, even Google is involved. For October 26th, the national forecast estimate is 1,800 to 5,200 new COVID-19 hospitalizations per day. State-level forecasts also show a high degree of variability, which results from multiple factors, and 4 of the models predict increases in hospitalizations in Iowa during the next month. Over the past week or so, Dubuque hospitals have seen increased admissions due to COVID-19. Why is this important? Because it's one area we want to plan ahead for and assure we have the capacity to serve the community need for hospitalizations. We know that only a fraction of COVID-19 cases will end up in the hospital, but as our number of cases continues to increase, along with the test positivity rate, it greatly increases the chance for more hospitalizations. That's where I come back to stress all we have to do, and we all have to do our part in preventing and limiting the spread of this virus. By now, you know what to do. The biggest battle is to fight our pandemic fatigue and not slide back into pre-pandemic actions of congregating with unlimited number of people or being out in public when maybe we're not feeling 100%, just to name a few. It's hard to believe it's October 1st, and we've been living with this virus among us for 6 months. We will have to make it through at least another 6 months, or 2 seasons in pandemic mode. Thanks for tuning in today. Have a great October weekend in a COVID-19 safe way, because we're all in this together.